Let me ask a brief question. How many cases of MRSA did we have last year at the end of 2006?
We have, from the information that I presented to you from hospital discharge data, which is the
No, just what's the, you're the state.
Yeah.
How many, what's the number?
We don't have the total count of MRSA cases in the state.
Okay, so then this is my point. If you don't have the total count, then why do I have any confidence in anything you just told me? I'm wondering, given that you're evaluating whether or not this should be on your list, whether or not that gives us good information on which to act, meaning being reportable. And you've mentioned various categories of being reportable, but I'm wondering how long are we going to debate that question? And again, as you said, you were evaluating other states in terms of what they're looking at. I mean, are we looking, is that what, have they not solved it for us, or are we going to, California have some sort of other type of resident that has a different standard, or why isn't Tennessee's standard good enough for California?
Well, I'd like to then move forward from what we've done in the past to the present situation, and we've heard about the epidemic of community-associated MRSA. Now, from my practice in the hospital and with outpatient clinic, this has just exploded over the past several years. And it's just tragic to hear of cases like the Moss family. And sadly, there's other tragedies like that out there that I've seen myself, where previously healthy children can get infected with this organism, and when it causes pneumonia, it has virulence factors that eat away at the lungs and destroy the lungs. And these children are fighting to breathe, and they just can't. Oxygen doesn't get there. And so I've certainly seen patients, children, previously healthy children, die from this infection. As well as children who didn't die but ended up having severe infections, such as infections of the bones, causing clots, and these patients required multiple surgeries and multiple months of antibiotic therapy.
We've heard infections cause nearly 100, hospital-acquired infections, nearly 100,000 preventable deaths nationwide. Estimates are that it's about 9,000 a year in California alone. And as we've heard earlier, they cost about $3 billion, add $3 billion to the healthcare system in California. Over the course of the last 4 years, we've collected nearly 2,000 stories nationally from people who have either gotten an infection themselves or had a loved one affected, and Carol Moss being one of them. And these are just really horrible and heart-wrenching stories, as you heard.
And I've asked some of you the question, but is there an epidemic? And why don't the answer here was epidemic. Yes, and yes, yes. Okay, all right. So everyone's in agreement to that. Let me ask the final question before we move on. In terms of, you've had 3 meetings from July to now. I was asked by a reporter earlier whether or not, is this, and I think it's a question that most Californians are asking, and that is this an epidemic, or is this something that, without statistics, how do we know?
It is an epidemic.
Okay. Thank you very much for your testimony.
So she says, well, do you think it's like MRSA, or, what do you think it is? And the doctor stopped and looked at her and said, why are you asking that question? You're not in the medical profession. So she says, well, with all the national attention and the news, she says, and besides that, she says, I have a friend of mine in California whose son died of it. So he says, well, to put your mind at ease, he says, I'll do a culture and I'll also give him a strong antibiotic. So lo and behold, a few days later, it came back, it was MRSA. And she called me basically to say, thank you for telling me the story. Because she says, otherwise I would have just followed, my normal, the pediatrician's information, and she says, so from my perspective, you could have helped save his life, save his life, save his life.